Happy Hand Hygiene Day. I'm Dr. Divya, Infection Control Medical Officer, SIMS Hospital. Hands are very important. They make us feel safe. We have to keep them clean. Let us see why hand hygiene is so still important.
We at SIMS, we always follow hand hygiene.
கைகளை கழுவுவோம், தொற்றுகளை தவிர்த்து ஆரோக்கியமாக வாழ்வோம்.
Hello, I'm Dr. Ramakrishna, Senior Consultant Gastroenterologist from SIMS Hospital, Chennai. In our field of gastroenterology, diarrheal disease is something which has killed many people, including children. So hand hygiene or washing hands when taking care of people or before taking care of them is very important in preventing transmission of diarrheal disease. The message today is that hand hygiene is important, hand washing is important. It saves lives, it prevents disease, and will keep you healthy. Thank you.
எங்கள் கைகளை சுத்தம் செய்வதன் மூலம் நோயாளிகளில் நோய் பரவதை தவிர்க்கிறோம்.
கைகளை சுத்தம் செய்வோம்.
Hi, I'm Dr. Sharmata, Senior Consultant Dermatologist at SIMS Hospitals. As a dermatologist, I always come across contagious diseases, and most of the contagious diseases are transmitted by contact through the hand. So, I always support hand hygiene.
Hi, I am Dr. Sandhya Vasan, obstetrician and gynecologist. So on this hand hygiene day, I request everybody to wash your hands before and after doing any procedure, because it not only protects you from infection but also it is good for the patient and it can prevent any organism entering your body as well as patient.
Neurosurgery practice la infection is the dreaded complication. Adala hospital occurred infection na is a worst type of complication any neurosurgery patient can get. So, hand hygiene is the most important preventive measure. It is not just the responsibility of the doctors or the nurses. All hospital workers are important there. So, now what rounds I tell even the relatives of the patients that they should know hand hygiene and they should see that it is practiced by all, including doctors and nurses. It is also the responsibility of the patients, attenders also who are with the patient all the time.
Hello everyone, I am Dr. Kanimuri, microbiologist here. So as a microbiologist, I know how many microbes and different infectious bugs are there around in our hospital. So hand hygiene is the best and simple act which can prevent spread of infections. Kindly do effective hand hygiene and prevent infections. Thank you.
Hand hygiene is a very important aspect in our day-to-day life, but people may not understand the importance of that, because the hand can get contaminated in many places. Like when you are even in go to outside, you go to a shopping place, you touch something, and then because where people crowd together, chances of microorganisms and the bacterial load may be very high. Secondly, in the hospital it is even more important, because as medical professionals see patients one after the other in the OP also and inside the ward, and when you even climb the stairs, I have seen people holding handrails. When you hold the handrails, so everybody will be holding handrails. Whoever is have a sterile, hand which is clean, nobody knows. Then with the same hand you go and eat some food, you can get contamination. Plus, when you see one patient, especially in surgical wards, there is an infection or something. If you touch something and go to another patient, it can contaminate it. But a simple solution, I find all these things. We did a study long ago, like just wash your hand with clean water itself washes away about 70% of the microorganisms. So one has to remember that, so that you can have a safe life without infection, because our body resistance is very low nowadays. People, because of various climatic conditions and so many other things, the body resistance is generally low. So one has to keep it in mind.
As a healthcare worker, I support hand hygiene. Hand hygiene is the most important, I will say, as a duty of any healthcare worker. Before we touch a patient and after we touch the patient, see, that is the most important way to prevent infection from spreading from one patient to another. See, there are various scientific studies which have proven beyond doubt that simple measure like this, hand hygiene, will prevent lot of cross infections. Now the infections have become very, very severe. They have become resistant to all the known antibiotics. I think prevention is the best way to prevent all these multi-drug resistant infections.
இன்ஃபெக்ஷன் ப்ரிவென்ஷனில் இருக்கிறதுலையே மேக்ஸிமம் பெனிஃபிட் கொடுக்குற ஒரு இன்டர்வென்ஷன்னா ஹேண்ட் ஹைஜீன் தான். ஹேண்ட் ஹைஜீன் நான் சொல்கிறது நீங்கள் சோப் அண்ட் வாட்டரில் கை கழுவினாலும் சரி, ஹேண்ட் ரப்பை போட்டு பண்ணாலும் சரி, இல்லை கெமிக்கல் யூஸ் பண்ணி வாஷ் பண்ணாலும் சரி, ஏதாவது ஒரு முறையில் பண்ணும்போது இன்ஃபெக்ஷன் ஒருத்தர்கிட்ட இன்னொருத்தருக்கு பரவுறதை கண்டிப்பாக குறைக்க முடியும்.
The WHO has raised a question as to why we still have to continue education on hand hygiene. Hand hygiene is the simplest form of preventing transmission of infection, but also the most difficult to enforce in any situation because people forget to wash hands between patients. To ensure compliance, we now have hand rubs, which has made the compliance better. Let me also remind you that we are coming back to this simple form of preventing transmission, which was initially discovered 150 years ago to prevent puerperal fever. That is, Semmelweis had found that many of the obstetric deaths could be prevented by the simple measure of washing hands before delivery.